Hi, guys. Dr. Hampton here with Tonika Greenwood. Tonika is a patient of mine and a guest on my Protecting Your Nest podcast, episode number 43, where we discuss everything related to metabolic surgery, also known as bariatric surgery. I will have a link to that episode in the show notes to this video. Today, Tanika wanted to ask me a question that may have been on your mind as well. Tanika, what question do you have for me today?
Dr. Hampton, my question is I just don't understand why they suggest that I should avoid alcohol after having bariatric surgery. Why is this necessary?
I know it seems like, what's the big deal, right? So, as a doctor who tries to be evidence based, I actually looked up the medical literature in the past because I was board certified in obesity medicine. So these are the things we had to learn. And, what I found is that many of the people who need to have bariatric surgery also have dependence issues. In other words, a lot of them have processed food addictions, which, as you know, is very prevalent in our society, but even more prevalent in people who need this type of surgery. But thankfully, we have experts out there like Dr. Joan Iflin with the Reset community who have resources to help people who have processed food addictions, whether it's related to surgery or just their life prior to even thinking about surgery. So I'll make sure to have a link in the show notes, which will help people who need help in that area. But there are many types of addictions, as you know. When I think about it, I think about things like tobacco. 40 million Americans deal with tobacco addiction. When I think about alcohol, it's around 18 million. And in third place is marijuana addiction, which is in the 4.2 million range. So a lot of people are suffering from addictions. And since many patients who sign up for bariatric surgery are having addiction issues and addiction personalities as well, many of the weight loss surgical professional team members that I work with, they discourage alcohol consumption after weight loss surgery. So it's really like trading in, one addiction for another. And my colleagues and I really worry about those empty calories as well. So when you drink alcohol, you get a lot of empty calories. So let's keep that. So alcohol itself has about 7 calories per gram. And although we're really into carb restriction when you're in a low carb space, calories do matter a little bit. So, and if you think about 7 calories per gram for alcohol, carbs and protein have about 4 calories per gram. Fat has more at 9 calories per gram. But again, it's really how your body uses these things that matter. And when it comes to alcohol, you've heard this, like alcohol is one of those like empty calories, right? So there's really no nutritional value in alcohol at all. And the other thing that happens with alcohol is that it really slows down your fat burning. You may ask, well, why does that happen? Well, it happens because your body and your liver in particular is responsible for processing alcohol. So since there's no nutritional value of alcohol, your body will try to get rid of alcohol first. And guess what? When it's processing alcohol, it's actually not breaking down fat. So it actually slows down the fat burning process, which is crazy. And then it also may trigger the part of your brain that'll make you hungry. So a lot of people, when they're drinking alcohol, they're trying to, snack on some things they probably shouldn't be snacking on as well. Another thing weird about alcohol is that it can reduce your blood glucose levels. So as you could imagine, when your blood glucose level goes down, then your body's going to want to replace that glucose, which will make you hungry. And the last thing we think about, and I think we all know that alcohol can lower our inhibitions, right? So, but I'm not talking about that stuff we shouldn't be doing. I'm talking about just like your inhibitions to avoid the foods that you shouldn't be eating, those processed foods that we talked about a moment ago. So those are the things that I worry about. Those are the things that my colleagues in the bariatric space worry about. And those are the things that my patients need to worry about. So again, a year or so after having surgery, it's probably okay to start consuming small amounts of alcohol. But in general, the general rule of thumb is to avoid alcohol if you've had any bariatric surgery. So, Tonika, any thoughts on what your experience has been like as it relates to alcohol and having had bariatric surgery?
Well, my experience with bariatric surgery and my tolerance for alcohol, I'm not a big alcohol drinker anyway, but when prior to the surgery, I was able to, have like 3 or 4 glasses of wine. And now I've noticed after bariatric surgery, my tolerance is very, very, very low. I think probably like after 2 sips, I have a buzz. So I try not to drink because of the simple fact I know for a fact, um, not even half a glass, I'll have a buzz.
Yeah, I believe that. And when I was in my obesity training, that's one of the things they talked about is that your tolerance for alcohol changes greatly when you have surgery like this. So that's another great reason to avoid it because it won't take much at all to give you that buzz. So thank you for this great question. I think that it'll probably help people who are contemplating this or who have gone through it and are just reflecting back on it. So, and for those who are checking out this video, if you want to continue to get great insights from my guests like Tonika and myself, like and subscribe to this channel so you won't miss any of my videos. I really appreciate you guys taking the time to watch this video. And until we meet again, be safe, be well, and continue to protect your nest.